Did you admit all? There you go.
They're still coming in, just a few. All right. Good evening,
Hello.
everybody. Welcome, welcome. We're just going to wait another moment or two as a few more people are coming in to join us. All right. Great. All right. So I see there's still a few people in the waiting room, but we will get started. Good evening, everybody. Welcome to our workshop this evening. We are really excited about our topic this evening around demystifying insurance, especially relative to autism. So the title of ours is Demystifying Insurance Coverage for Autism and Behavioral Health. And we are really excited to have Amy Weinstock here with us to help us to understand all of the ins and outs around this. But before we get started, a few housekeeping items. My name, for those of you who don't know me, is Elizabeth Bostic, and I am a previous member of the board for the Federation for Children with Special Needs. And if you're joining us tonight, you're joining us as part of our Connecting Families series, which really is an effort to make sure that we are providing as much information for families, as much meaningful and useful information for families as we possibly could, and is in direct response to some of the requests that we're hearing in multiple ways through the outreach that we're doing and the communication that you've been providing for us. It really is an opportunity for us to have that two-way communication and exchange of information. We will have multiple people monitoring our chat, so if you have questions during Amy's presentation, please feel free to put them in the chat, and we will do everything we can to let her know when something might be connected to something that she is talking about. And then as well, she'll be happy to answer some additional questions as time permits at the end of the presentation. We have also put in the chat a link to Wordly. So if you need interpretation of what Amy is saying, please use the link there to adjust the text to your language of choice. And I think that is it for now. So I would love to introduce my friend and colleague, Amy Weinstock. Amy is the Director of Insurance Resource Center for Autism and Behavioral Health at the UMASS Chan Medical School's Eunice Kennedy Shriver Center. That's a mouthful. And an instructor in the medical school's Department of Psychiatry. She has an extensive background on insurance issues related to autism and has played a key role in passing several significant pieces of autism insurance legislation in Massachusetts, including the groundbreaking 2010 law requiring health insurance to cover medically necessary treatment for autism. Amy also serves as a trustee of the Riverview School Living Independent Forever and is a commissioner on the state's Autism Commission. Following a successful career in real estate and baking, Amy, the parent of a child on the autism spectrum, decided to merge her personal passions and professional experience. She completed the Leadership Education and Neurodevelopmental Related Disabilities program, the LEN Fellowship at Eunice Shriver in 2005. And following this, she served as the president of outreach organization of the Lurie Center for Autism in Massachusetts General Hospital for 2 years, prior to her appointment as the chair of the Insurance Committee for Advocates for Autism of Massachusetts, also known as AFAM. Amy's work has been recognized through numerous awards, including the Federation for Children with Special Needs Martha Ziegler Founders Award, the Margaret L. Bowman Award for Excellence, the Massachusetts Arts Distinguished Citizen Award, the Autism Speaks Advocacy Award, the Doug Flutie Jr. Foundation Shining Star and Essential Peace Award, and the Northeast Arcs Edward C. O'Keefe Memorial Award. She's a graduate of Wellesley College and received a Master of Architecture from Harvard University. And oh, by the way, happens to be on faculty at UMass as part of the LEN program, which is where we got to know each other. So Amy, thank you so much for all that you've done on behalf of our families with autism, specifically related to insurance. And we look forward to learning from you this evening on how we navigate this labyrinth together.
Oh, thank you so much. So Forget everything that Beth said. My credentials here is a mom. I've been a mom brought to my knees by not being able to access treatments for my daughter, and I need to update that bio because she's not a child anymore. She's a young adult. But I survived, and my hair is the same color. It gets a lot more chemicals. So I title of the presentation may be ambitious on demystifying insurance coverage for autism treatment. You may be more confused than later, but I have about 3 hours of slides to cover in an hour. I'm going to do my best, but ask questions in the chat. I will, try to get to those at the end, and I am able to stay on a little bit longer if people need to. But the most important slide to get you to stay is our contact information, which will be at the end, and everybody is welcome to reach out to us. And thank you to Beth for that introduction, and to Pam and everyone at the Federation for hosting this. You're just a great partner of ours. You've been a source of support for me ever since, I entered this world, and we're so happy to be here. So I am going to give some background on kind of how I got here and how insurance kind of came to be, an overview of insurance coverage in general, different pieces that people have. Then I'm going to discuss treatment for autism treatments. I'll probably spend a lot of time on how Mass Health secondary coverage can help families, because that's really the glue that holds so much of this together for people who have private insurance. I'll discuss behavioral health coverage, finding providers, and showing you a pretty neat tool that we use a lot, and then how insurance affects IEPs. And if you don't stay for all that, the cliff notes are insurance should not affect IEPs, but I'll explain that why we get there. So as Beth noted, I direct the Insurance Resource Center for Autism and Behavioral Health, which is part of the UMASS Chan Medical School's Shriver Center. And we are a resource for the entire community, consumers, providers, employers, educators, and others on issues related to insurance. We even have insurers sometimes reach out to us for guidance and advice. And we have 4 main functions. Our primary function, or the one that we probably spend the most time on, is information and technical assistance. We receive thousands of calls every time I cite a number, like 3,000, 4,000, kind of blow through that. So I'm just going to say thousands, but probably somewhere around 5. We provide a lot of assistance related to access and coverage for treatment, including mass health questions and issues. I know the Federation gets a lot of those too, particularly now with the end of the public health emergency and some of the moving pieces. And for children with autism, behavioral health, and families with more complex needs, mass health, which is already complex, can be super, super complicated. And then we have what I think is a great website with wonderful documents providing a lot of information on coverages, and it's all great information. Some of it's meaty, so if you ever can't sleep at night, just pop onto our website and look at some of that. But importantly, we do a lot of webinars and trainings for organizations like the Federation and others. We also have our own presentations bi-weekly. We have a lunch and learn series. If you want to be on our mailing list for that, you can get it. And it's a lot of the same topics I'm discussing tonight, but they're short half-hour presentations, and they kind of tend to delve into a specific topic. So we just had one today on what is ABA. We're going to have one, and we've had one previously, on what is premium assistance, how Mass Health secondary insurance can help families. I'm going to touch on all those topics. Not going to really discuss what ABA is tonight, but those are recorded and they are on our website. So if you have specific interest in some of those, you can go look at them. So in layman's terms, what we do is everybody, fortunately in Massachusetts, should be insured, have insurance. I mean, the number of calls from someone who are uninsured is probably, we could count them on one hand. However, on those insurance cards, this is from another state, but not different, there is nothing on that card that explains how one can get coverage for behavioral health treatments, autism treatments, what the co-insurance might be, whether it's even covered or not. And then maybe if you're lucky, your card might have a phone number to call for behavioral health. But other than that, there's not too much on there that explains it. And then there's lots of laws and regulations, both on a state level and a federal level, that impact. And then to make it even more complicated, I would bet, given the number of people on this, attending this tonight, there are probably at least 2 people here who have identical insurance cards, but they're actually subject to different laws and regulations. So what we do is help people figure out what their insurance covers. I will say people don't usually call us to say, just want to let you know, my insurance is great. It's working great. I'm getting everything I need. I have no issues, which doesn't mean there aren't many people for whom that is the case. We just don't ever meet them. We do sometimes meet them, like if we're out in the community, but we help people figure out what their insurance should be covering, whether there might be a need for Mass Health Secondary, whether it might be cost effective or not to get that, if there are other gaps, and then if they're encountering barriers and challenges, everything from finding providers to insurance denials and everything in between. That's the kinds of questions we get. A lot of providers call us with similar questions, and clinicians will call us. And in addition, we also help the state agencies. We are part of the state medical school, and we work closely with all the various state agencies, as well as the regulators and the legislators, because as I noted, we affectionately call ourselves Complaint Central, but provider may be having a devil of a time getting authorizations or other kinds of things. When we see multiple people reaching out on the same issue, it can help us spot a trend that any one person might be dealing with, and we can bring that to, sometimes we just bring it to the insurers. We have good relationships with all of the major ones, and they help us solve it. And if not, if it's a more fundamental issue, we can bring it to the regulators, to the state agencies, to say something isn't working right here. And it's not good guys, bad guys, people trying to make things difficult. It's just so complex, and there's so many moving pieces, and things are constantly changing, that there's just many opportunities for things to go off the rails and not quite work so well. So how I got to this work, the bio is like the sort of official version, but this was my family in 2000 when my daughter was diagnosed, and I love this cartoon. We're there, like, unfortunately, you have what we call no insurance, because at that point in 2000, there wasn't insurance. And the belief and the expectation was, if you had a child with a developmental disability, you went to your school. We were really fortunate that we got what was considered an early diagnosis and benefited from early intervention. But, we were kind of on our own. And even though by 2000, the researchers and the science and the medical profession understood that autism was a neurobiological disorder, and there was effective evidence-based treatment, insurance really viewed it as not in their domain. And had this been 1970, autism would have been really believed that this was something that was caused by mothers who didn't know how to love their children. There was a very well-known famous psychiatrist who coined the term refrigerator mother. So in 1970, they would have sent me for treatment. By 2000, we knew that it wasn't necessarily that, it was something else going on, but we still couldn't get coverage for it. So I think this quote from the New York Times, that no disability claims more parental time and energy than autism, could probably be debated. It's not an easy road for anybody, but we're certainly up there in the thrashing and the stress, etc. So I didn't have any clear vision that I was going to set out to do anything about that, other than, the first 5 years or so I really spent trying just to keep my family together and the wheels on the bus and put one foot in front of the other. But I was working at the time Elaine was diagnosed in finance, on the risk management regulatory side of it. And in that 2005 2004, I decided that I was going to leave the workforce and pursue that work-life balance. If anybody here is thinking about that, let me tell you, it's a myth. But I figured as long as I was going to have all this extra time on my hands, I really wanted to see if I couldn't apply some of my background in that realm to the issue of insurance coverage or lack thereof and do something about it. So as Beth noted, I did go to the Shriver Center and did a one-year fellowship called LEND, Leadership, Education, and Neurodevelopmental Disabilities. My banking colleagues thought it was pretty funny that I was leaving banking to go to a program called LEND, but I was. And Beth followed along. Beth, you did it about 3 years ago. Beth was the LEND fellow. There's a good alumni club of us out there. And I like, this is being recorded, so I shouldn't say it, but I will. I like to think of it as our little terrorist training camp. We train people to go out and cause good trouble. Beth, I think you caused a lot of trouble even before you got to LEND, but I went there and with this idea that insurance should cover autism treatment, which was radical at the time. I mean, people thought I was a little stark raving mad, or maybe at the best they thought I was naive. And, can't tell you the number of really leaders in the field, respected people who are like, look, you're a parent, you're coming to this from a total different thing. You don't understand how services are delivered. And I had this very simple premise that if, unfortunately, Elena had been diagnosed with something like cancer, and I wouldn't wish that on anybody, insurance would cover the intensive treatment to give her the best shot. And I didn't think autism should be treated differently. So right now, that's much more accepted than it was then. So I did a research project on expanding insurance coverage for children with autism. And when they do the movie version, they'll say, oh, she wrote this paper and she took the T to Park Street and she went to the State House and she got a law passed. But many of you have worked on legislation and advocacy. It doesn't happen that way. But I'll give you the short version. And so in that LEND paper, at the end of it, I had some quotes and inspiration that I had come across that I thought might guide me, and they proved to be incredibly salient. So this was probably my favorite, which was from Dr. Robert Jarvik, the inventor of the artificial heart, and said, leaders are visionaries with a poorly developed sense of fear and no concept of the odds against them. And, I put this paper away. I didn't really think about it for a long time, almost until after Erika passed, and I was starting to have to, go around and talking to people about it. But I like to say, Erika passed with the fearless and the clueless. So the fearless were the leaders in the center of this, which is Senator L'Italian, who is also the parent, Governor Patrick, who signed the bill, and Larry Kinkler from the Red Sox, who really helped us with the advocacy. The clueless were the advocates amongst me in the picture on the right that I never thought would become so infamous. Of me in a t-shirt that I lived in for a few months in the State House with pearls, which wasn't intended. It just happened that way. And if there's time at the end, I'll tell the story. And then lots and lots of parents who came out and supported us. And, we did this on a shoestring. We were all volunteers. We had no budget. We chipped in and got these little stickers printed with the Got Milk font, Got Insurance, not if you have autism. And we slapped those on anybody who came too near us to see them. And we had an advocacy day at the State House, and this little boy came with his mom. I wish I knew who he was now. And it really wasn't until I blew up the picture to not have his face in there that I saw the shirt she had dressed him in, Making Mister from Where the Wild Things Are, that I thought was just so cute. So I'm going to show you my favorite video in the whole world, which is the signing of this bill that really started the systemic change that started our work. I hope you guys can hear that.
Some insurance companies are
Can you
not
hear it?
happy, but the
Okay.
parents of autistic children were cheering at Fenway Park today. They called it more exciting than a playoff series. The governor signed a bill forcing insurers to offer a full range of coverage.
And News Center 5's Pam Cross is live at the ballpark tonight, where advocates are calling this, Pam, landmark legislation.
They do call it landmark because it covers a variety of medical services for a number of ages. They held it here at Fenway because a member of the Red Sox family is an autism advocate, and supporters say the governor and the legislature hit this one right out of the park and over the green monster. They waited a long time for this.
Both my husband and I are school teachers. We work 2 and 3 jobs to pay close to $15,000 a year just for things that our insurance company won't pay for.
They filled a section of Fenway Park to say thanks. The law requires insurance companies to provide coverage for all forms of autism. It affects the 10,000 Massachusetts residents with autism, both children and adults. Advocates believe the state will save money.
Either the families are going bankrupt, taking care of their kids, or the kids aren't getting the care, and the payer of last resort is the state.
So this is for Amy and Jack and Elena and Mary Catherine and George.
With their adult autistic son watching, one of the bill's sponsors named the children of those who worked for 2 years to change the rules. They got a salute from the governor.
You are the reasons why, no matter what else was before the legislature, this issue and your needs would not be forgotten.
Someone had said it's a home run, I think the mayor said, but actually to me, it's the bottom of the ninth and somebody had a grand slam today for autism.
In fact, they're probably looking for some grand slams tonight. Business says that this is a bad idea, that it will push up premiums for everyone. But with the numbers of autistic children growing each year, others say the law is real relief. Reporting live from Fenway Park, I'm Pam.
Oops. Okay, so we can just watch that video over and over. It's my favorite, one of my favorite videos. And we were pretty excited. I think if I had known that was just really the start of the work, I might have taken a different course. But it was a groundbreaking law. It was a seminal law. And we were excited. It was really excited that it was signed at Fenway Park. We had a little party afterwards. There may have been some alcohol consumed, and then kind of woke up the next day and we're like, oh gosh, what do we do now? Because this was such new coverage and there was no systems, there was no infrastructure. Many of the people providing this treatment weren't licensed professionals. There were no CPT codes and some of the things that are just so fundamental to billing for coverage. So it was really almost more questions than answers, but we had a very solid law behind us. And that ultimately led to the establishment of what was the Autism Insurance Resource Center in 2011, where I was lucky enough to be asked to direct it, and back at the Shriver Center where all this trouble had started. And then subsequently we expanded in 2020 to formally encompass, even though we were working a lot on it, behavioral health, and changed our name to the Insurance Resource Center for Autism and Behavioral Health. And it's still not come up with a cute, great acronym for it. So here we are. So I'm going to give just an overview of insurance and explain how this affects our work, what we do, why it's important, and answer a lot of questions and get into a lot more of the, what I'd say, the more nitty-gritty technical aspects. So as I said, everybody has insurance, and it falls into one of probably 3 main buckets. There's a few other different types that might be outside of this. We'd have too many bubbles, but you generally either have public insurance or private insurance, and these circles intersect because you can have more than one. And if you have developmental disabilities and others, very often you will have more than one. So public insurance, which is the yellow circle, is our Medicaid, which in Massachusetts is called Mass Health, and Medicare. And our private insurance falls into 2 main buckets. One are what is called fully funded private plans, and those are state regulated, which means they are subject to the Massachusetts laws, of which Eureka that you just heard about was one, and there are many others. And then the self-funded plans are federally regulated, and they also include most of the same autism benefits. They're just sometimes managed differently, and they're not subject to the Massachusetts laws, which tend to be amongst the strongest. And if one needs to actually pursue any kind of remedies or stuff, if you're state regulated versus federally regulated, that influences where you go and what you do with those. Just to explain the difference between fully funded and self-funded, because there's confusion. A fully funded plan would be a plan that usually a small to mid-sized employer maybe even the Federation, I don't know. You purchase from an insurance company and they underwrite it and they give you a cost based on numbers of employees and other parameters. And then employees have copays, deductibles, et cetera. And if an employee's child has strep throat and they go to the pediatrician, they have an exam, employee pays the portion that's theirs and the insurance pays the other. Similarly, if I'm looking at Pam here, if you need a quadruple bypass, you'll go and get that and you'll pay your portion and the insurance will cover that. For a self-funded plan, it's usually a mid to large size company. They, as is said here, and nothing insurance usually is, but this one is, they self-fund their plan. So those companies will put aside a pool of funds, and that's why it has to be an employer of a certain size that can bear that risk. And they pay those claims from their funds. So again, if the child goes to the pediatrician, the employer pays that portion of the claim. And if an employee needs major medical surgery, the employer is paying that, and that's why it is self-funded. But to make it more complicated, a self-funded plan, a company that is self-funded, doesn't give you an insurance card that says, we're funding this plan. So let's just say, you work for State Street Bank. That's a self-funded plan. Self-funded insurers hire what they call third-party administrators to actually administer the benefits, and they hire the same companies that sell the on plans. So when I showed pictures of insurance cards, it could be that someone who works for the Federation and has an insurance card from whatever your insurance is, and someone who works for State Street Bank might have identical looking insurance cards. Say you both get insurance from Blue Cross or Point 32 Harvard Pilgrim. You might have the same card, but you have different plans because the insurer is acting in a different capacity and they're subject to different regulations. So when I said you can look at your card and not know what you have, that's why it's confusing. And then if someone has Mass Health as a secondary insurance, and it will always be secondary to private insurance, I'm going to discuss that more later, you may be in one of those intersecting circles. So when people reach out to us, we try to figure out which bubble they are starting in or bubbles, and we can understand, what laws and regs those plans are subject to, and we can also try to help them figure out whether obtaining additional insurance, Mass Health Secondary, might be helpful for their specific situation. So as I mentioned, ERICA, which was the law that you just heard, that was the acronym, and Act Relative to Insurance Coverage, was system changing in that it was the first law that really said you have to cover habilitative and rehabilitative care. And it is sometimes referred to as an ABA law because ABA therapy is a very commonly prescribed therapy for children with autism. It was not an ABA law. It's just before that ABA was never covered. And ERICA very specifically required ABA to be covered. But I like to say it was written to be, quote unquote, deliberately vague. And this language, habilitative and rehabilitative care, including but not limited to, that's the exact language that's in the legislation. So that including but not limited to was meant to capture all of the therapies that might be medically necessary for autism, that were medically necessary in 2010, that might be different than what's medically necessary in 2023. And hopefully with research and evidence and other things, there might be more in 2033. And actually, to give you an idea of how things change, when we drafted ERICA in 2008, the iPad hadn't even been released yet. It was just released around 2010. And one of the people advocating with us at the State House had one and was, sort of broadcasting the hearings. We thought this was super, super cool, and never would have thought that, today, so many of us would live with these things attached to our hands, and many children use these for communication devices and all the other things that it's done. The other thing that this was at the beginning of, which is now much more common, is this law had no age limits, visit limitations, or dollar caps. There were many similar mandates passed around the country about the same time, but ours was the one that didn't have those, and it was the first of that. And subsequently, with additional laws and regulations and mental health parity, those limits and stuff have changed a lot, and there's a lot less of them, but we still hit those today. If there's any questions about that, please type those into the chat. So now I'm going to move over to the public side, which is the yellow circle and Mass Health Medicaid. There are several different types of Mass Health standard, not Mass Health, Mass Health standard is one type. There are several different types of Mass Health that people get. The eligibility and the type you're eligible for is determined by several factors. The primary one is income, age, then special circumstances, including having a disability, citizenship or immigration status affects that. You must be a Massachusetts resident. So we will often get calls from people who work in Massachusetts, have Massachusetts private insurance, live over the border, New Hampshire or Rhode Island, wanting to know if they can. You need to be a Massachusetts resident. You do not need to be a citizen. However, depending on your immigration status, if you're not a citizen, that affects the type of Mass Health you might get. You don't have to figure out what type you're eligible for, although it sort of helps to know what you're looking for. There is one application for Mass Health. You complete that and Mass Health determines what type you're eligible for. You might not always get it right the first time. And I always say, if we had a nickel at our center for every family that calls and says, well, I was told I could get Mass Health Secondary, my child's disabled, but when I called, they told me I wasn't eligible because I have other insurance, I make too much money, XYZ. That's a very, very common thing that happens to people. It's really unfortunate. It's a barrier that shouldn't be in place. But if we got a nickel for everyone that happened to who reached out to us, we would not have to do as much fundraising as do, because unfortunately it happens way too much. So people with disabilities are usually eligible for Mass Health regardless of their income. However, and this is another, it's not necessarily free. So if you qualify for Mass Health based on your income, it means you're pretty low income and you don't get charged for it. If you qualify for it based on a disability, you may be above income and you may be charged a premium for it. If you are, it's a sliding scale fee, so it's designed to be affordable and accessible. And you are eligible for Mass Health even if you have other insurance. The other insurance will always be primary, but you can get Mass Health. And then the reason I say the two most common types of Mass Health for people with autism, behavioral health needs are Mass Health Standard or Mass Health Common Health is so that you kind of know what you're aiming for. And you don't need to say, oh, I know I fall into this bucket and my income is over, so I need to apply for Mass Health Common Health. It's one application for Mass Health and they figure out what kind you're eligible for. But when a family calls us and they say, oh, you know, I'm unable to access coverage for my copays for behavioral health treatments and I have Mass Health Family Assistance, don't try to understand that. But to us, that's a very clear indicator of something might not have been captured in the application yet. The disability determination might not be on file, that they probably need to be in Mass Health Common Health and probably should be in Mass Health Common Health, but it didn't all get ticked and tacked and tied together the way it needed to be. So I just say, you know, if someone says they have Mass Health Standard or they have Mass Health Common Health, we're pretty confident that they are in the right place. So frequently asked questions, and I'll get to the ones in the chat after this. Can a child receive Mass Health and also have private insurance? I bolded that because the answer is yes. Private insurance is primary. But if somebody wanted to torture themselves and call Mass Health tomorrow or tonight or whatever, you could call them 5 times and you would probably get several people and several answers, because the customer service people just sometimes don't know this, that you couldn't and wouldn't be eligible. Does someone have to have an autism diagnosis to answer ABA, to access ABA therapy? The answer is yes through insurance, not always that same case through schools and other ways. If my child has Mass Health, do I have to maintain them on my private insurance? Again, the answer is yes. Mass Health is always the payer of last resort. We do have families who are sometimes advised, even by providers who I think should know better, just drop your kid from private insurance. It's just a pain to deal with. It's too hard. And you can effectively do that. But when redeterminations and renewals happen as they are going on now, Mass Health, finds that information, they get that information, and it's not pretty. And then Mass Health does not expire, but Mass Health periodically redetermines eligibility. So you typically have to go through an annual redetermination. Let's see what the next slides are. So I'm going to get to that. But before I do that, I'm going to answer some of these questions. If private purchase insurance, not by a company, does it fall into a private funded plan or different? So if a family purchases a private plan, like say a direct buy plan from an insurance company, that will be a fully insured plan from the insurance plan. I think that was your question. My daughter has autism, low muscle tone. We applied for Mass Health, I'm assuming, and she got disqualified for that. So they probably, I'm assuming, looked at your income, other insurance, and determined she wasn't eligible, but they didn't tell you that if you completed a disability determination form, she would most likely be eligible. And so that's, again, a very common call. And if that was recent, or if you want to revisit that and you contact our center, we're happy to help you complete that application, get to where you need to get to. And I work with parents of students with disabilities. Should I encourage them to all get Mass Health secondary insurance? Not necessarily. They should know about it. For families that have large either uncovered treatments or co-pays or deductibles or health insurance premiums, it may be cost effective, but for some, it may not be cost effective. And so you should encourage them to be aware of it. And they can certainly reach out to us or the Federation and get information about whether or not it would be a help for their family. So I would say inform, but don't necessarily encourage. So we've had families reach out. They say, my therapist told me that I had to get this. I have a $25 copay every week for my son's speech therapy. I went out and got it, got through the whole process, and I got a bill for a premium that's way more than the $25 I pay in those copays. And there just wasn't a lot of other benefit to that. And it can always be canceled, but why go through all that if it's not going to be cost effective? But if someone is considering it, we can certainly, at our center, help them understand what the benefits might be based on their specific situation, whether or not it might be cost effective or not. What is the redetermination and how do you get disqualified? I'm going to be going through that now, so I'm going to hold that question. And when your child turns 26, can we keep her on our work insurance? So this is one of the best kept secrets. A disabled dependent can stay on a parent's policy beyond 26. All dependents can stay on until 26. Disabled can. And I don't know how old your child is, but I would start thinking about that when they're in their mid-20s. You don't have to do it super, super early, but the answer is definitely yes. And the way you do it is you reach out to your insurer or your company and say, my child's disabled and they need to stay on the policy. And then each insurance company has a slightly different application process for that. So we at the Insurance Resource Center, we have lots of fact sheets, and there's one on Mass Health Common Health, which I don't know if anybody on this, I don't know if anybody from my team is on this. If you are and want to go to the website and post some links to those in the chat, that would be great. If not, maybe someone from the Federation. But we have fact sheet on Mass Health Secondary called Mass Health Common Health. And we have a fact sheet on maintaining disabled dependents. And in some of those lunch and learns that are on our website, we have specific presentations on those discrete topics. So the renewals and redetermination process is, I'll just get to the last question. Someone posted, they have a speech provider who does not take Mass Health, but they have Mass Health as secondary. Can I submit to Mass Health for reimbursement of the copays? Unfortunately, no. And this is when we might work with a family to see if it's going to be cost effective or not. Providers have to be Mass Health providers in order to get the secondary and the copays covered. So there's sometimes for ABA providers an ability to get a single case agreement for the copays, but even then, the ABA provider has to do that. It's not like some private insurance where a provider can just bill a family and a family can take that receipt and submit it for reimbursement. So you can't, families cannot submit anything to Mass Health for reimbursement. It all has to go through the provider. How long can disabled dependents stay on past 26? Yes, it is usually as long as the parent has the policy. In some cases, there are retiree policies. Some insurers only approve it for a finite period of time after which they revisit it, but they can stay on it. It's not like it goes to 28 or 30. Are the premium rates differ for disability when Mass Health is used as secondary? So the rates are dependent on a number of factors, but there aren't different rates depending on what kind of disability you have or autism or not. There got a surprise hike in the premium as secondary. That could be because of the renewal redetermination, but it doesn't hurt to, take a look at it if it was a surprise. If it seems like it was high, sometimes the information doesn't get in correctly. So we actually, one of the biggest train wrecks we saw with the redetermination was a family submitted their information and the annual income got erroneously entered as a weekly income. So income was basically like 50 times higher and they got, oh, congratulations, we redetermined, and a bill, literally, it was like $12,000 a month. So I would have thought it should set off some circuit breakers and someone would have taken a look at it. And we were able to look at it and see where the mistake was and help get that corrected. And in fact, the premium ended up being about $140 a month. And again, being the sort of centralized complaint thing, when we see that, not only was it a problem with this application, it did indicate that something didn't work the way it maybe should have. And we bring those things, we brought that to Mass Health and said, maybe you want to look at what happened here to see if we could have avoided some of the pain and suffering, because that mom, I'd like to say we had to kind of maybe talk her a little bit off the ledge. It was not good. So the redetermination process is not new. It happens every year. However, the reason there's been a lot of discussion around it and a lot of organizations, including the Federation, doing a lot of work is that during COVID, there were protections in place to make sure people didn't lose coverage. So Mass Health did not do these redeterminations during the public health emergency. And you can see I haven't updated these slides. The public health emergency ended in April and Mass Health and everybody, it was federal law that they had to renew and review all enrolled people. So people need to make sure their contact information is current because we are getting calls from families who've lost coverage. And sometimes it turns out that the mailing address in the system wasn't the current mailing address and they got requests for information, but it went to the wrong place and they didn't know. The best way to do it, if you can, is to actually have an online account with Mass Health where you can go in, create that account, and then you can see everything online. And as we all know, with a lot of things, that works more smoothly these days than some things. And then read all your mail because they're sending letters and they're supposed to be in big blue envelopes that I'm going to show you, but some people are getting white envelopes and other kinds of envelopes. And you can't miss an envelope like this usually. However, it doesn't say Mass Health for privacy information. It says the Commonwealth of Massachusetts. And sometimes people are getting white envelopes that say enrollment center, processing center. Well, those look like magazine ads and this and that. And the marketeers are always one step ahead. So I was really excited when I saw these blue envelopes and I'm like, okay, this is going to be hard to miss. I can't tell you how many envelopes I get like this now that look big and they're bright colors and they're looking for things. And when I open it up, they're looking for me to donate money or do something that really is not something that requires a response, but these do. And when you submit that information, whether you submit it online, which is probably the best way to do it, or if you mail it in, they may review it and decide they need some more proof of income, residency, et cetera. You have 90 days to do that, but we always say just put it in as quickly as you can. And if you can do it online, that's great. But even then, you know, some people submit it and it takes 2 or 3 submissions till it actually goes through and gets there. There are lots of resources and people in the community to help, including, I believe the Federation is helping families with this. Our center is helping people. There are these certified assisters. So you can find them online. You can call Mass Health Customer Service and get some help and get a person who can actually walk you through this and help you and look online. And our center, we don't advertise it, but we can also help people with this as well.
Amy, we have 2 people who are on staff who are able to help people.
That is great. And again, you know, these are things that will be in the slide deck, which I will send you so you can distribute that if you want to follow these step by step. And I don't know if, Pam, are you getting calls from people who've had their Mass Health coverage terminated?
Melanie, you want to answer that on what we're hearing from folks?
If people have had their Mass Health coverage terminated, yes. I mean, we have all kinds of levels of issues, and we're going out into the field as well to like
right,
senior centers and homeless shelters and what have you. So we do see a lot of it, especially with the homeless shelters when the addresses have changed multiple times. And we've seen one interesting case was like a family that had a guardianship of an adult with a disability, and the communication was going to the person's group home as opposed to the guardians who had changed their address. And so we see all kinds of stuff.
Oops, one thing, I guess it wasn't in here. This is a massive effort. It started last spring. It's going through this spring. But so a lot of people were like waiting and calling us in May going, I didn't get my blue envelope. What Mass Health also did is they get data from a lot of different federal databases and other things. And they look at, matching data. So there were many people who didn't have to renew. And I think in general, Mass Health does these kinds of checks periodically, and in sort of non-COVID, post-COVID times, if data, an income on a federal database showed something that was within a certain percentage of what was on the Mass Health application, they just went ahead and verified it and did it. For this renewal, they actually changed that amount, and I can't tell you whether they went from 10% to 20%, but they put even more leeway so that more people could get just automatically redetermined if an individual had Mass Health, say through Social Security. I won't get into all that. That group was automatically redetermined. So they really tried to take buckets and people where it should be a standard pro forma, easier case. And they tried to do as much automatically as they could. But there were still many people where it was 3 years and they needed that. And they give you a lot of time. They send notices, but we are seeing people with that. And if people have had their coverage canceled, it can get reinstated, but it's not without adventures and disruptions, and particularly with children with autism behavioral health needs who might be receiving pretty regular treatment, just a gap of 2 or 3 days till that gets fixed can wreak havoc in all the other underlying systems. And, we're all pretty skilled at putting the pieces back together again, but it's much better if it doesn't happen in the first place. I'm going to see what the next thing is. So before I talk about premium assistance, but I'm going to leave this on here. Oh, and we're getting a little close for time, but I can stay on late and I'll go through these questions. If a child is a U.S. citizen, the child should qualify for Mass Health. Yes, even if the parents are not. Would Mass Health cover co-pays if the clinicians don't accept Mass Health. I think I covered that. Unfortunately, the answer is no. So I'm going to talk about Mass Health premium assistance. And besides being able to keep your disabled child past
Amy, can I interrupt for a second? There were two questions in the Q&A that I want to make sure we don't overlook.
Oh, I'm sorry. Okay. Can we keep Mass Health as the only insurance? If you have access to private insurance, then the answer is no, except for some very limited situations. I started a new job. My 19-year-old has Mass Health. Will my income affect his insurance? His only income is SSI. Can I claim him on my taxes? So the answer to all of this is kind of maybe. A lot happens when children are in transitioning and all kinds of other stuff. So I would recommend that you reach out to the Insurance Resource Center for some specific answers to those questions. Thank you for that, Pam. So in terms of premium assistance, we all know that there's insurance available through the Health Connector, and there's lots of subsidies, or there are subsidies for people whose income is within certain things. Mass Health premium assistance is a completely separate benefit. It was around way before we had a Health Connector and an exchange. And what it is for people who have Mass Health Standard or Mass Health Common Health and employer insurance, which you have to keep if you have that. If your employer insurance meets certain requirements in terms of copays, deductibles, residency, et cetera, Mass Health will reimburse you for the cost of that insurance up to usually the entire cost that a family pays for that insurance. So it's not like if you're a family of 4 and you have one child with Mass Health Secondary, they'll pay 25%. If the policy meets the criteria, they will pay the whole cost to the employer. So it can be an extremely helpful benefit as employer insurance just gets more and more expensive every year. And it can make the difference between insurance or that Mass Health Secondary being cost effective or not. So there was someone who noted that they got a redetermination, I believe, and they got a surprise hike in their premium from Mass Health, even though it was secondary. We're getting a lot of those calls. So it was probably related to the redetermination, but in many cases, families are eligible for premium assistance, and the cost of that or the amount of the premium assistance reimbursement more than covers the Mass Health premium they've been assessed, and they actually end up getting a check every month for the difference before they've even used the Mass Health for any secondary benefit. This only applies to employer and group plans, so Health Connector plans aren't eligible. Plans with deductibles that are $3,000 in individual, it's like 6,000 family are unfortunately, and we see those and even higher, not deductible. Individuals receive Medicare, are not able, and that's the Mass Health member, not the parent, and the person has to live with the policyholder. I did say if a child is on your employer insurance and Mass Health, yes, if the policy is, if that employer policy meets the criteria for premium assistance, that whole premium might get reimbursed. And when parents retire and work insurance ends, are there benefits for the adult child? Usually if the work insurance ends, the child and the parents need to find other insurance. Are there more questions about that? Okay, great. So now I'm going to sort of switch and talk about behavioral benefits. So this is non-autism behavioral services. So people may know that there is something called, for a long time, CBHI, Children's Behavioral Health Initiative. And in 2019, the state started requiring insurance, but it's only the fully insured state regulated plans, so the little blue circle, to cover similar services. And they were called BECA, Behavioral Health for Children and Adolescents. We love our acronyms. So that was expanded in 2019, right? And then the world changed a lot in 2020 with COVID. But BECA and CBHI are quite comparable. There's only one small difference I'm going to get to. Just BECA is for private and CBHI is for things. However, BECA only covers services to age 19. Don't ask me why. And then CBHI covers up to age 21. And these services that are covered, it's a whole range of behavioral health services, and they're essentially the same. And for children who might need behavioral health supports, even with an autism diagnosis or without, but especially without, you can get a lot of services through CBHI that can be extremely helpful. And I'm just going through these. Again, these only include private, fully funded plans. The GIC and federally are not required to adopt it. However, I believe it was 2021 or 2022, the GIC did begin covering BECA, and many self-funded plans cover either some or all BECA services, especially the out-of-state ones. They may cover some of the services like in-home behavioral health services or in-home therapy, but they might not cover, say, therapeutic mentor or other things. And as I said, Mass Health started this coverage. So, you know, we get these things, oh, CBHI went away. Well, nothing happened to CBHI except that for private insurance, it sometimes unfortunately became more challenging to access treatment because you have to go through the private insurance first. And if private insurance is not covering insurance, it can sometimes be really hard to get a denial and explanation of benefits. And some of the CBHI providers who were doing this just with Mass Health for 10 years, and that was complicated enough, have just found it challenging to work with private insurance and don't work with that. And so we're working on that. We've been continuing to work on it, but it can be a challenge. If you're a family trying to do this, do not drop the primary insurance, even though providers sometimes say that. Contact us for assistance. Reach out to Mass Health and or the Division of Insurance. Reach out to us. Don't give up. But this is one of the challenges that we are seeing. I don't know if we have time for this because we're at time, but one of the hardest things is trying to find a provider. And there is a great resource called mabaaccess.com. I'm going to get to the end of the presentation and then go back and demo this for people because I think it's a resource that people don't know about. It's a great way to find providers, but I'm going to just go through questions, and the next like 5 or 6 slides are step-by-step instructions of how to use the database. I'll show a quick demo, which will give you that, and then you'll have this in the slides of how to try to find one. But the great thing about this database, unlike all the others, including the ones that we have at our center, is this one shows updated availability and openings. Providers update this with. So if you're trying to search for a provider, and even if you don't have Mass Health or you don't have MBHP, this is a good one to go to because many of those providers also take other insurances, and this can help you kind of narrow down a list much more quickly to find openings. And so I'm just showing that. And then again, the $64,000 question, and if you go back to the beginning when I explained how, when I started this journey, I not have insurance coverage, and the only access we had for treatment was through the school. We wanted to make sure that none of this expanded coverage would affect people's ability to get services through their school. And so we did a lot of work on this, and school laws are covered by something called IDEA. And, you know, the Federation knows a lot more about this than we do, but under IDEA, schools are required to provide free and appropriate public education, which is not the same as medically necessary treatment, but oftentimes there's overlap. And what was FAPE, free and appropriate private education, under IDEA in 2008 is free and appropriate public education in 2024. And all the expanded coverage gives families a lot more options to get services or get treatments outside of school, but it doesn't change what schools are required to cover. So just on a simplistic thing, if anybody goes to an IEP meeting and they say, oh, well, your kid qualifies for an hour speech a week, but we know you're getting that through insurance, so we're not going to put that in the IEP. That's not how insurance works. And so families should just be aware of that. And if you're having trouble, you should reach out to us or the Federation, and we're all happy to help. Here's our contact information. We do not charge for our services. We are very fortunate to get funding from the funders here who help us provide those services. Our email, our phone numbers. My email is here, and in case you haven't figured out, I'm passionate about this, but it's better to go through our main numbers just because we are really busy and really big, and we get a lot of calls. And so a call at 4:45 on a Friday that or an email to me directly that I intend to answer. If it's not so critical, sometimes it's Tuesday and it's buried under a zillion emails, and I have forgotten that. So I'm going to answer some questions if people can stay on, and then I'm going to go on to just give a quick demonstration of Mass ABBA. And I know if people have to jump, it's getting to be dinner hour, but thank you for joining today.
So Amy, can we just pause for just a moment? Just to, we will absolutely let you continue, but I just wanted to pause. It is 6 o'clock, so if people are going to be jumping off, I just wanted to give a quick shout out. First of all, thank you. This has been amazing information, and I know this has been very helpful for folks. And to remind folks that if you're not able to stay, this information will be uploaded to the website along with the recording, and you will any questions we weren't able to answer or we will be able to get responses for those and post those as well. And of course, any questions you have, you'll be able to reach directly out to the Insurance Resource Center to get those questions answered. The other thing I wanted to remind you of are two things. One is the Visions of Community Conference that's coming up on March 9th. I call it the Disability Homecoming. It will be held virtually, so please visit the website to learn more about that because registration is open for that. And then also a new project that we're really proud to have at the Federation, the Caregiver to Caregiver Respite Network, a real opportunity to leverage the shared experiences of caregivers to be able to support each other to provide respite based on those same shared experiences. So if you haven't heard about that, please also go to the website to learn about that so that you can press a tab to get updates about that program and also to start putting information into the website so that when we're ready to start matches, which will be very, very soon, your information will already be part of that database. So thank you for all of those who have joined us up to this point and need to leave for this evening. We will continue to record Amy's responses to questions as she's doing them and also the demonstration and upload that information to the website so that everyone will have access to them.
Thank you. And thank you for hosting this. So I'm going to take questions that are in the chat. I think there aren't any in the Q&A, just kind of in order, and then I'll show the MABA database. I sent the disability forms to UMass Chan. That is not our center. It's a different department applying. So for the people who were told like you're not eligible for Mass Health, you get denied on income, on other insurance, and then when you complete the disability determination, then you get approved. Or sometimes you get approved for a limited form of Mass Health based on your income, and then when you complete the disability determination, they upgrade it, so to speak, to Mass Common Health. So the approximate turnaround time, or the stated official one, is 60 days. It can sometimes be faster. If there's a problem and their medical releases aren't signed and they don't have all the information, it might get stuck a little longer. If you've been waiting longer than, say, 30 days or so, you can always reach out and call them for an update, make sure they received it, but you can reach out to our center, and we interact closely with that group, and we will, when we're helping a family apply, we will track those and make sure that they get approved. So if you've been waiting a while and you haven't heard anything, either reach out to Disability Evaluation Services, and their phone number is right on the form, or reach out to us and we'll try to help you. But the question, do they cover ABA after age 21? Private insurance does not have an age limit. Mass Health, it ends at age 21. There is legislation that's been filed to extend that age limit, but currently the age limit is age 21. Do I have to add my adult son 21 to private insurance? So adults don't have to be added. You might want to, it might be advantageous, especially if you could get premium assistance. I'm assuming he has Mass Health. The thing about dropping children and not keeping children on insurance was for children under like 18 or 19. Above 18, they're considered adults and you don't have to keep them on your insurance. Do you need to inform your employer prior to being 26 to keep them on private insurance? Yes, 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 capital yes. I always say we don't have a lot of issues with people being able to keep their children on, but they have to be on before they turn 26 and you have to do it. And it's a good idea to do it, at least 6 months. Some employers will say, come back 3 months. You don't wait till it's 3 days or 30 days before. We can help and you can sometimes still do it, but yes, you definitely want to do that. Can we change Mass Health coverage for undocumented children with autism? Generally not. There may be certain circumstances where you can do it, but usually, unfortunately, it's a Mass Health limited insurance that only covers really very basic emergency medical care and does not cover the behavioral health treatments and other situations. We don't have a great solution for that, except to point out that the education laws do not factor in immigration status. So we advise families and people who support families of undocumented children to just really try to work hard to get services and supports from their school. The problem is there's sometimes a lot of sensitivity around immigration status, and sometimes getting those services, even if you don't have an immigration concern, it can take a lot of pretty fierce advocacy, and parents can be a little concerned about that. When is it insurance responsibility to provide home services and when is it the schools? So insurance covers medically necessary treatment. Schools provide free and appropriate education. Sometimes home services are necessary for free and appropriate public education. So if it's part of FAPE, then it is the school's responsibility. That could also be a service that might fall under medical necessity. And in that case, it's the parents' kind of choice and decision of which route and which way they want to pursue that. Insurance generally will not cover any services in a school. Again, generally, not always, but the home services, it could be either. Some comments, few, a lot of questions. Do they send any letter informing you they got the disability form? I don't know if they acknowledge that they've received it. When the determination is approved, again, I'm not even sure you get a letter, the Mass Health coverage changes. So the fact that you didn't receive an acknowledgement doesn't mean that it's not working and they haven't gotten it. But if you want to follow up and make sure they have it, that's a good thing to do. Melanie pointed out that for the undocumented immigration, there is legislation called Cover All Kids that is aiming to change that. Do other services end when people turn 21? A number of things change. It's probably better that we cover that a little outside of this. But medical treatment continues, but CBHI under Mass Health and ABA under Mass Health does end. So do people have time? I'm just going to try to stop sharing my screen and flip over to the MABA Access website just to show people how we use that to search for things, and then we'll kind of wrap up. So I'm going to share a different screen now. Hopefully people can see that. Oh, I was demonstrating this in Arabic, but I'm going to go back to English. So just know this is available in a lot of different languages. Should be at the top. Oops. Oh goodness. Here we go. Okay. Can people see that now? Okay. So as I said, I'm going to show you how this database works, and it's the database for MBHP providers, but many of the providers here take other insurances. So it is very worth looking at if you're searching for a provider. So if you're looking for a provider, you go into Youth and Family Services, and then there's the thing to find provider openings. And it brings you to a whole list, and you can just go up and down this list. And I'm just going to do ABA, but you can see it's all different services. ABA was added later. It's been a few years now, and it, surprise, surprise, became one of the most widely searched things. So say you're looking for an ABA provider. Beth, can you tell me the age of the child you'd like to look for? You're on mute.
Yeah, 9. Let's do 9.
Let's do 9 years old. And we can put in a city or a zip code.
01830.
Okay. Okay. And then they give you this option for ranges. 30 miles is pretty good, especially like if you're looking for home services and you don't, provider's going to come to you, it doesn't necessarily matter. What I would say is like going to like 10 miles or 20 miles is sometimes limiting. And that used to be the default. It looks like they've changed that. So you're looking for an ABA provider. So what is good about this is that it shows not only names of providers that they service children 6 to 12, it shows the available capacity and openings. So again, I don't have to tell people that there are a lot of wait lists, but at least if you have a list, even like you might call your insurer and get a list of providers, you can go to this list. And if it's a provider that shows they have an opening, that might be one that you want to call first. And providers will put notes. So here's a provider that says they have an opening, but they're noting that it's for availability before 3 p.m., some social skills after 3 p.m. That's helpful. The other really helpful thing is that providers list have to update this, and they're supposed to update it every week, but you can see that not all of them do that. But some of them are updating it fairly regularly. But, here's a company that I have never heard of called Thrive Social Learning. They had 10 openings. All sounds great, but they only updated this 12 months ago. So if I were talking to a family, I'd say, you know what, this is pretty old, and frankly, it's not a company we've heard of. That might not be a current opening, but it helps you, go down. You can see here's one with 2 openings. They updated a week ago. They have after school center-based openings. If that's what you're looking for, that might be a place that you want to call. What we're not finding necessarily are companies with a lot of after-school home-based services, and that's unfortunate. So you can see that this is a really great list and a powerful one. I'd be happy to do another search if anybody is wants me to try that. And in the slide deck, there's step-by-step instructions, because sometimes it looks good when I'm showing it and you go into it and go, how did she get there? So does anybody want to unmute themselves and ask me to do another search? Okay. Thank you, Leslie, put in a link to MABA Access as well.
Okay. All right, let's just double check. I think.
Oh, somebody asked if this is only for MBHP. So the database is maintained by MBHP, and these are all MBHP providers, but many of the providers on that list accept other insurances. So even if you don't have MBHP, if you're searching, it's a good tool to search for, but you'd obviously have to verify with the provider that they serve this. Question, does PCA also end at 21? No. But just Beth, am I correct on that?
No, it doesn't. No, you
Doesn't.
can have PCA all the way up through adulthood.
Yeah. I did see a few people join really late, and I know I'm guilty as charged. I shared this on social media, and I shared it thinking it started at 6 o'clock. So I got here on time, fortunately. But if anybody joined late because they had the wrong time, the Zoom link and the Zoom invitation when you registered had that. But this was recorded and will be posted by the Federation, and we have the slide decks. And I apologize, Katie, that it started at 6.
So once again, Amy, thank you so much for this very comprehensive presentation on insurance and really helping us to understand how to navigate all of the various hurdles and challenges that are mass health and insurance in general. And also thank you again for being such an amazing change agent on behalf of our families with autism. It's Landmark is indeed an appropriate way to describe the legislation that you were so effective in making sure took place. So we really are incredibly grateful, as I know many other families are. As Amy said, this presentation, well, PowerPoint and the recording will be uploaded to the Federation website so that everybody will have access to all of the information, no matter what time you may have or may not have arrived this evening. And as I said before, there are some exciting things happening at the Federation. The Visions of Community Conference is coming up on March 3rd. You don't want to miss it. It will be held there virtually, and you will have access to all of the different presentations and breakouts that will be taking place for a number of months afterwards if you register. So please make sure that you take the time to do that, because there is lots of information that will be shared. And in multiple languages as well. We're doing everything we can to make it as accessible to as many families as possible. And then also we're very excited about the Caregiver to Caregiver Respite Network, which is going to be launching any day now. You can learn more information about that on the Federation website as well, which will give you an opportunity to indicate if you would like to receive updates so that you can be in the know when it actually does launch, and also start putting some of your information in their database so that when that happens, we can start immediately at looking for a match for you to find another caregiver who has similar lived experience to be able to provide respite for you and you for them. So more of that to come very, very soon. Very, very excited about that. And all of the other things that are happening at the Federation. It is certainly a very busy group of people. So I have always said, similar to Amy, the Federation was there from the beginning for when King James was growing up. And anytime I had a question, I knew where to go. I call it the one-stop shop for any family who has a child with special needs. If we can't answer the question immediately, we will find somebody who can. So thank you again for joining us this evening. We'll look forward to seeing you again next month. And in the meantime, be well, be safe, and see you soon.
Thank you, everybody.
Good night.
Thank you, everyone.